This is part 2 of our anatomy and physiology review, and I believe I left off with the peripheral nervous system, so that's where we're going to pick up in part 2. The peripheral nervous system refers to the nerves out here in your periphery, particularly the 31 pairs of nerves that are named after the vertebrae that they exit. And then the spinal plexus is the area of convergence and divergence of the nerves for transmission of impulses to the body. And we have 3 areas of the body where this spinal plexus occurs: the cervical, the brachial, and the lumbosacral. Now we know that damage to the spinal cord or any nerve may result in widespread neurologic deficit, which may never heal. Trying to get it to go to the next slide here. Apologize for that. All right. The peripheral nervous system also includes the cranial nerves. And the cranial nerves are 12 pair of nerves that are divided into sensory nerves, somatimotor nerves, proprioception nerves, and then your parasympathetic fibers, or your parasympathetic nerves. As I mentioned, you had 12 pair of cranial nerves, and they're attached directly to the brain itself, where your sensory nerves and your motor nerves, they exit the spinal cord, and that information has to be transmitted back to the spinal cord, and from the cord get to the part of the brain where it needs to be, where the cranial nerves are attached directly to the brain itself, and they exit out different parts of the skull, and essentially are responsible for functions from the shoulders up. And what I like about the cranial nerves is that one of the assessments that I teach to assess for pain is to do a trapezius pinch, and to pinch that trapezius nerve, which is one of the cranial nerves. And depending on the response you get, it not only helps you answer the motor question to your Glasgow-Coma score, but it also gives you a better idea of consciousness when compared to doing a sternal rub. And we'll talk more about that in a later lecture. The peripheral nervous system is divided into the parasympathetic nervous system and the sympathetic nervous system. The parasympathetic nervous system is known as the feed or breed, or the rest and digest nervous system. It also has the name cholinergic nervous system because the neurotransmitter for the parasympathetic nervous system is acetylcholine. And when the parasympathetic nervous system is stimulated, it releases acetylcholine. And acetylcholine, when it reaches the receptor sites on your organs, causes specific things to happen, like gut motility, like the production of mucus, and the production of tears, and the making of urine, and those sort of things that we don't think much about. The sympathetic nervous system is the nervous system that is stimulated when you respond to a stressful situation. It's also known as a fight or flight response, and also known as the adrenergic nervous system because the neurotransmitter for that system is adrenaline. So when the sympathetic nervous system is stimulated, the adrenal glands that sit on top of the kidneys release adrenaline as well as norepinephrine and dopamine, and those chemicals help you prepare to fight or flight. They dilate your pupils so you can see better. They dilate your bronchioles so you can take in more oxygen. They cause release of more glucose so that you have more energy in order to fight or flight as well. Now, I had mentioned receptors, and receptors are sites on organs that respond to these different neurotransmitters. You have alpha 1 and alpha 2 receptors that are found on some organs. And when alpha 1 and alpha 2 receptors are stimulated or occupied by a neurotransmitter, it causes vasoconstriction. It also causes smooth muscle contraction and inhibits glucagon. Now, insulin, we know, is the hormone that lowers blood glucose, and glucagon is a hormone in your body that actually raises blood glucose. In those situations where we need to increase our blood sugar, and as a paramedic, if you're unable to establish an IV or an IO in a patient with a seriously low blood glucose, you'll be giving glucagon in order to raise the blood sugar. Beta 1 receptors, when they're occupied by a neurotransmitter, beta 1 is heart. So beta 1 is an increase in heart rate, an increase in strength of contraction, and an increase in the speed of conduction, which allows the heart rate to increase as well. Beta 2 is lungs, where you get bronchodilation, you get vasodilation. Beta 2 relaxes the intestines, relaxes the bladder and the uterus. And beta 2 is an example of a beta 2 drug, or a beta 2 selective drug, is albuterol. We like to give albuterol breathing treatments because it is beta 2 selective. There isn't always a increase in heart rate when you give albuterol because it's beta 2 selective. Beta 3 allows for lipolysis, which is the breakdown of lipids, and involves hydrolysis of triglycerides into glycerol and free fatty acids in the adipose tissue or in fat. Triglycerides is it's your brown fat, it's your liquid fat. It's that part of your body that when you start to burn energy and you're out of sugar, it's going to burn that first. I had mentioned neurotransmitters, and the neurotransmitters for the somatic nervous system is acetylcholine, and the autonomic nervous system, which consists of the parasympathetic and sympathetic nervous system, the neurotransmitters are acetylcholine for the parasympathetic nervous system. That's why it has the name cholinergic. And the epinephrine and norepi for the sympathetic nervous system. And epinephrine is another word for adrenaline, and that's why the sympathetic nervous system is also known as the adrenergic nervous system. Other neurotransmitters released in the central nervous system include dopamine, and we'll learn all about dopamine, the synthetic dopamine that we would administer to a patient to do different things at different dosages. Serotonin and gamma-aminobutyric acid. These neurotransmitters bind with the receptor sites on the postsynaptic membrane of the organs, causing a predictable response. As we mentioned, alpha 1 is going to cause vasoconstriction. Beta 1 is going to cause an increase in heart rate. And many of the medications that you're going to learn about fall into that alpha or beta category. Now, hormones are part of the endocrine system, and the endocrine system is made up of glands that secrete these hormones. And these hormones are released into the circulatory system and carried to the different organs and tissue in the body, and do cause a predictable response. There are two types of hormones. There are steroids, corticosteroids, mineraloids, and proteins. The hypothalamus is, as we had mentioned, in the brain, and it's the neuroendocrine system. The hypothalamus controls the anterior pituitary gland, and the hypothalamus causes the release of different hormones that inhibit growth, that work on the thyroid, that work on the gonads, and that work on releasing of milk. The pituitary gland is located at the base of the brain. It's below the optic chiasm, and it has two lobes, an anterior and a posterior. It produces hormones as well, and the pituitary gland is like a pea-shaped gland. It's rather small, and when the pituitary gland gets cancerous and they have to remove it, they go up through your nose in order to remove that gland. The thyroid is at the thyroid cartilage, the thyroid gland, and it has two lobes, a right lobe and a left lobe, and the thyroid gland is responsible for controlling metabolism. And people who have hypothyroidism is a condition where their thyroid is not secreting the hormones that it should to help regulate metabolism, and their metabolism comes to a crawl, and they usually are heavier as a result of a low metabolic rate. And somebody with hyperthyroidism is usually skinny and can eat everything they want, and because their metabolic rate is quite fast. The parathyroid is situated in the posterior aspects of the thyroid gland, and the parathyroid is responsible for increasing calcium levels in the blood. It also stimulates bones to release calcium, and it inhibits the excretion of calcium by the kidneys. So the parathyroid is responsible for regulating your calcium, which is an extremely important ion in the control of muscle contraction. The adrenal glands sit on top of the kidneys. There are two layers. There's an outer cortex and an inner medulla, and the adrenal gland produces corticosteroids like cortisol, aldosterone, as well as epinephrine. The pancreas, we often don't think of the pancreas as an endocrine gland, but it is, and it is midline to the retroperitoneal space, just below the stomach, and a point of reference we should be familiar with concerning the pancreas is the islets of Langerhans, and the islets of Langerhans is where insulin is secreted from. It's the beta cells in the pancreas that create insulin, and insulin, again, is a hormone that is used to lower blood glucose. The thymus is located in the mediastinum. They're in the center of the chest, and the thymus is responsible for creating T cells, which are part of your ability to fight infection. Now, the cardiovascular system includes the heart and the vessels, and the components of blood include plasma, include red cells, white cells, platelets, and white cells are divided into different types as well. You have monocytes and lymphocytes, eosinophils and basophils and neutrophils. And when a physician orders a CBC with a differential, they not only get the number of white cells that are in the blood to see if they're elevated, but what type of white cell is elevated. If it's a basophil, then they know that you're dealing with an inflammatory response. If it's a neutrophil or an eosinophil, they know that you're dealing with either a parasite issue. They also can tell whether the infection is early or in the late stages in the infectious process. The heart pumps blood throughout the body. It is a 4-chambered, electrically driven muscular pump. It's got the 2 atrium, left and right, and it's got the 2 ventricles, left and right. It is enclosed in a 2-layer serous membrane, the pericardium, and the muscle itself, the heart muscle itself, is composed of 3 layers. The endocardium, which is the inside, the myocardium, which is the muscle itself, and the epicardium, which is the outside layer of the heart. We hear of coronary arteries and coronary artery disease, but many will refer to the coronary arteries as epicardial vessels. So they're on the outside of the heart. The heart is located in the thoracic cavity, about the size of your fist, somewhere below the 2nd intercostal space, down to about the 5th intercostal space, just to the right of the sternum a bit. Excuse me, just to the left of the sternum a bit. The heart is a really unique muscle. It's responsible for pumping blood to all parts of your body. Excuse me. So it has to work from before you're born right up until you die. And it has the unique property of automaticity and conductivity and contractility. And those properties allow the heart to for each cell in the heart to generate its own electrical impulse. And there's also another property we need to be familiar with concerning the heart, and that's called the Frank-Starling mechanism. And the Frank-Starling mechanism is a condition where if you stretch the myocardium, you fill it really full and stretch those muscle fibers, they'll respond back with a much stronger contraction. It's a lot like taking a rubber band and stretching it. The more you stretch the rubber band, the bigger snap you're going to get from it. And the Frank-Starling mechanism tells us if we increase preload, we put more blood into the heart, that's going to stretch those chambers, and it's going to pump more blood out, or increase the stroke volume, which is the amount of blood pumped out of the left ventricle with each contraction. Stroke volume, the amount of blood ejected from the left ventricle with each contraction. Other terms we need to be familiar with concerning the heart include cardiac output, and that's the amount of blood that the heart pumps in a minute. And cardiac output is a product of stroke volume times heart rate. And anything that affects stroke volume or anything that affects heart rate is going to affect cardiac output. As an example, if your stroke volume decreases as a result of shock or hemorrhage, you have less blood coming to the heart, you're going to have less blood coming out unless the heart rate increases. If the heart rate slows way down, then the stroke volume has to increase in order to maintain cardiac output. And the importance of maintaining cardiac output is that cardiac output is necessary to maintain adequate blood pressure. So factors that affect cardiac output include an increase in stroke volume without a change in heart rate. That's going to increase stroke volume. A decrease in stroke volume without a change in heart rate is going to decrease cardiac output. An increase in heart rate without a change in stroke volume is going to increase output, and a decrease in heart rate without a change in stroke volume will decrease output. You can read the rest of the slide and you get the idea that for cardiac output to be maintained, one of these things have to constantly adjust itself. Either the stroke volume has to increase or the heart rate has to increase in order to maintain stroke volume when there's a change in the other. Now, blood pressure is the mechanical function of heart, measures that we measure. Blood pressure is the mechanical function of the heart, and we measure the blood pressure with a blood pressure cuff. And the pressure that we're measuring includes the pressure in the system when the heart contracts, and that's known as systole, and the pressure in the system when the heart is at rest, which is diastole. And the important number there to me is diastole. And the reason it is the diastolic pressure is the constant pressure in the arteries all the time. The diastolic pressure is the pressure that left ventricle has to work against in order to get blood to all parts of your body. So the higher that diastolic pressure is, that's more of a concern to me than that systolic number. Blood pressure is a product of cardiac output times peripheral vascular resistance. And peripheral vascular resistance just has to do with the size of your blood vessels. If your blood vessels constrict, much like a garden hose, as I have pictured here, when you're sitting there looking at a garden hose, water runs out of that hose at a certain pressure. If you take your thumb and you put it over the opening of the garden hose, and you make that opening smaller, what happens to the pressure in the system? It goes up. And that's what has to happen in your body in order to maintain blood pressure, is that your vessels are constantly constricting and dilating in response to the need to raise or lower blood pressure to any one part of your body. In discussing the heart too, we can't forget the 8 great vessels, the superior and inferior vena cava, the aorta, the 2 pulmonary arteries and the 2 pulmonary veins. They're the major structures, the major vessels that bring blood to the heart, as well as the vessels that take the freshly oxygenated blood to all parts of the body. Now, the venous side of the great vessels, the superior and inferior vena cava and the pulmonary arteries, are low pressure vessels. And so when we get things like a tension pneumothorax, or we get things like overzealous bagging by an EMS provider causing an increase in intrathoracic pressure, those pressures can get so high that they actually collapse the venous system of the 8 great vessels, and collapse the superior and inferior vena cava, and collapse the pulmonary arteries, allowing for no blood flow to occur. If we were to dissect the heart open, we could see the chambers and the valves. The heart is divided into a right and left half. It also is separated by the septum. The septum runs not completely down the center, but does separate the heart into a right side and a left side. And then you have different valves. You have semilunar valves, the pulmonary valve and the aortic valve. And these valves allow for the movement of blood during systole and diastole. And then the AV valves, the tricuspid and the mitral valves, allow for blood to flow from the atrium to the ventricles. Now, in every EMS class I've ever taken, I've had to know the route in which blood flows through the heart and to the lungs and back. And I think it's a concept that we should be familiar with, because as we look at what happens when that heart fails as a pump, blood is going to back up into the system. And depending upon which side of the heart is in failure, if you say, for example, you only have the left side of the heart that's in failure, then you look at where does the left side of the heart get its blood from? Well, that comes from the lungs. So if you're in left heart failure, blood backs up into the lungs, and the pressure in the vessels raises to the point where you develop acute pulmonary edema. Whereas if the right side of the heart fails, it gets its blood from the superior and inferior vena cava. So blood is going to back up into those systems, and you're going to get an engorgement of the liver, you're going to get jugular vein distension, and fluid accumulating in the lower extremities. So this is just a diagram that illustrates the flow of blood through the heart. Comes in from the superior inferior vena cava, fills the right atrium. On contraction of the atrium, the tricuspid valve opens up, allowing for the right ventricle to fill. On the contraction of the ventricle, the pulmonary valve opens, allowing blood to flow into the pulmonary arteries, the left and right pulmonary arteries, to the lungs, where gas exchange takes place. And as it comes back from the lungs through the right and left pulmonary vein, it ends up in the left atrium, where the mitral valve opens when the left atrium contracts, allowing blood to fill the ventricles, and then when the left ventricle contracts, the aortic valve opens up, allowing blood to go out of the aorta. Now, this happens, as I had said, 60 to 100 times a minute, sometimes slower, sometimes faster, every day of your life. It's an amazing muscle. Both atrium contract at the same time, and then both ventricles contract at the same time, pushing and moving blood to different parts of the body. Go. The coronary arteries, the epicardial vessels on the outside of the heart that give the heart muscle itself a blood supply, they fill during diastole. And that means the heart tissue is the first tissue to receive freshly oxygenated blood. And there are three major arteries that we're going to look at. You have the right coronary artery, or the RCA, and then you have the left coronary artery with two branches, the left anterior descending, or the LAD, and the circumflex. These are the major coronary arteries. And if we look at that right coronary artery, the right coronary artery supplies the right atrium, but it also wraps around the back of the heart, the inferior posterior portion of the heart, and so it supplies the left ventricle on the back side, as well as 1/3 of the septum. And if we look at that left coronary artery as it comes right out of the aorta, it divides into the left anterior descending artery and the circumflex artery. The left anterior descending artery is where that supplies the anterior surface of the left ventricle and the anterior 2/3 of the septum. The circumflex artery covers that left lateral wall of the atrium and left ventricle. Now, we had said that the heart contracts, and that is done through the movement of sodium and potassium in and out of the myocardial cell. Now, in phase 0 of the depolarization, which is the represents the contraction of the muscle, is depolarization, you've got a rapid entry of sodium in and potassium out. and the influx of the positive charged sodium into the cell causes the cell to shorten. And it's this overall shortening of from cell to cell to cell to cell that causes the muscle to contract. Phase 1, or early repolarization, that's the resting potential of the myocardial cell. The potassium slows its entry, and we see a small deflection in the potential action, the action potential or the current as it goes from cell to cell to cell. In phase 2, the plateau phase, calcium slowly enters the cell through the calcium channels, causing an increased period of contraction. So that's why potassium is so important. It determines the strength of your contraction. And certainly if you don't have enough potassium or enough calcium in your system, you're not going to get near as strong a muscle contraction in your heart. Phase 3 is the final rapid repolarization, where you have a rapid movement of potassium outside the cell, and that is represented on the ECG paper as a T wave. Phase 4 is the resting membrane potential, and that's where everything's lined back up to start all over again, where sodium moves quickly into the cell, potassium moves out, calcium slowly enters the cell at some point, causing a prolonged contraction of that cell, and then everything rearranges itself so it's ready to do it again. And here's just a visual of that actual cardiac action potential, and you can see the resulting graph in red represents the QRS and the T that we see when we hook the patient up to a heart monitor. Now, the heart has its own electrical conduction system. The sinus node is the primary pacemaker of the heart. It will beat at 60 to 100 pulses per minute, and as the sinus node fires, the impulses travel through the internodal pathways, and they end up at the AV node. Now, as that electricity from the SA node travels through the internodal pathways, it causes cell to cell to cell to cell to cell shortening as those cells depolarize. The impulse ends up at the AV node, and I like to think of the AV node as the gatekeeper to the ventricles. The AV node holds on to that impulse that it gets from the atrium for just a split second, no more than 0.2 of 1 second. So it just holds on to it for a short period of time, and this allows both atrium to empty their contents into the ventricles. From the AV node, the impulse travels down the bundle of His and down the right and left bundle branch, where it then spreads through the Purkinje system and causes the contraction of both the ventricles. Now, this is an organized, coordinated network of the electrical conduction system, but sometimes the SA node doesn't fire, or sometimes the SA node, there's a long pause between when it fires, and as a result, you have other pacemakers in your heart that can take over the job of pacing the heart in the event that the SA node isn't functioning properly. The AV node will pace the heart somewhere between 40 and 60 beats per minute, and the Purkinje system will pace the ventricles at least somewhere between 30 and 40 a minute, depending on need. Now, this represents this diagram represents the cardiovascular system, and includes not only the heart that we've been talking about, but certainly the lungs, the arteries, the arterioles, the capillaries, the venules and the veins, and the hierarchy of how blood flows through your body. Arteries and veins have three layers or tunics, and we have conducting arteries like the aorta and the pulmonary vessels. We have distributing arteries like the arterioles, and arteries have, because they're smooth muscle, have the ability to constrict or dilate, and by constricting you're going to increase the pressure in that area, and by dilating you're going to lower the pressure in that area. Now, venules hold large amounts of blood. In other words, veins probably are holding 2/3 or more of your blood supply at any given time. The capillary network, or the capillaries are small microscopic vessels that are single-celled, and that's where, in the capillaries, is where the exchange of oxygen between the alveoli and the capillaries take place, and then the exchange of cellular waste and oxygen and nutrients takes place at the cellular level as well. The capillary network consists of a method or a way to move blood through that system, and it does this with pre-capillary and post-capillary sphincters. These sphincters close or open and help regulate blood flow through the capillary beds and the surrounding tissue. In the capillaries, again, as I had mentioned, is where the exchange of nutrients takes place, where waste products, the exchange of waste products takes place between the intravascular and the intracellular space. Now, how this filtration occurs, how this exchange of nutrients and waste product occurs, depends on things like the capillary membrane permeability. Capillaries are single-celled, semi-permeable membranes. In other words, they don't let everything pass right into the cell. Some of the larger things, like proteins, are more difficult to move in and out. Particularly large proteins like colloids are difficult to move in and out because of the capillary permeability. Arterial hydrostatic pressure certainly affects the filtration and the flow of blood through the capillary beds, and then the venous oncotic pressure, that gradient between arterial and venous. The lymphatic system is part of the circulatory system, and that's your lymph nodes. And lymphatic vessels flow both ways, where veins flow to the heart and arteries flow away from the heart, with the exception of the pulmonary veins and the pulmonary arteries. Lymph is the fluid within the vessels, and the function of the lymphatic system is to remove excess fluid, to produce lymphocytes, and to distribute various products like nutrients and hormones to all parts of the body. The lymphatic trunk includes a collection of ducts or nodes. The thoracic duct collects from the lower body, the left arm, the head, and the neck, and the right lymphatic duct collects fluid from the right side of the head and the right arm. And then here's just an example diagram of the lymphatic system and where those major lymphatic vessels are and where those major nodes are. And we had mentioned the function of the lymphatic system was to collect excess liquid and distribute hormones and distribute nutrients and those sort of things within the cardiovascular system. The respiratory system, the primary function of the respiratory system is to bring oxygen into the body and to eliminate CO2. The respiratory tract then includes passages that move air from exchange surfaces, and the respiratory membrane is where gas exchange takes place, and so The respiratory tract would be your trachea, your bronchioles, your terminal bronchioles, and your respiratory membrane would be your alveoli. Your lungs make up your respiratory system, and they allow for the mechanical movement of air to and from the respiratory membrane. And here's an example, or certainly a picture, a diagram of lung tissue, the trachea, the bifurcation known as the carina, where the trachea bifurcates into a left and right main stem bronchi, and then smaller bronchioles, and then terminal bronchioles that terminate at the end of all these air sacs, or alveoli. The upper airway includes the nasopharynx, the oropharynx, the laryngopharynx, and the larynx itself. The larynx, the Adam's apple is another term certainly for the larynx. It's more prominent in men than women. You'd be a little leery if you were dating a woman with a very large Adam's apple. But that's where the vocal cords are located. That cartilage, hyoid bone, and the cartilage rings of the thyroid cartilage and the cricoid cartilage make up the larynx. And the vocal cords are protected and housed in there. Lower airway structures include the trachea and the bronchial tree, which I had mentioned begins at the carina, separates into a right and left main stem, and the tracheobronchial tree is lined with ciliated epithelial and goblet cells, and this cilia helps move mucus and infiltrates out of the lungs so they can be coughed up. And the bronchial tree branches into many subdivisions. You've got the main stem bronchi, you've got other bronchi, you've got bronchioles, and then terminal bronchioles. The lower airway structure includes the alveoli, or the air sacs, and their functional units, when open, they make up the majority of lung tissue, and that is where respiratory gas exchange takes place, is in the alveoli. That's where the exchange of oxygen and carbon dioxide occurs through a process known as osmosis. The lungs are located in the pleural cavity. They expand, they contract based on the movement of the chest wall itself. They are attached to the heart by the pulmonary trunk, the veins, and the hilum. Covering the lungs is the parietal pleura. That's the lining or the membrane that covers the lungs. And then covering the parietal pleura covers the wall of the chest. The visceral pleura is the membrane that covers the lungs itself. So parietal pleura, visceral pleura, and they're stuck together really tight. There's a small amount of liquid between them that allows for adhering of those two membranes tightly together. And then when you take a breath and they expand and rub, because there is that little bit of liquid in there, it's not likely that you're going to develop a friction rub from not having any liquid between those two pleura. Total lung capacity is determined by tidal volume. That's the normal amount of air then in one breath, and it's usually normal tidal volume for an adult is somewhere between 500 and 700 milliliters of air. Total lung capacity also includes the inspiratory reserve volume, and that's the additional amount of air that you could take in after a normal breath. So it's that extra air that you can draw in after a normal breath. The expiratory reserve volume is normally about 1100 mils of air, and the residual volume is the amount that remains in the lungs after a maximum exhalation. So when you exhale, your lungs don't completely empty of air. If they did, all your alveoli would collapse, and you'd have to work pretty hard to get them all open back up again. So watch when watching somebody breathe. When they're done with their breath, there still is quite a bit of air left in their lungs. When we look at pulmonary capacity, that's measured by inspiratory capacity, which is tidal volume plus the inspiratory reserve volume. Functional capacity is the expiratory reserve volume plus the residual volume. And the vital capacity is the product of the inspiratory reserve volume, the tidal volume, and the expiratory reserve volume. And then total lung capacity is vital capacity plus respiratory or residual volume. Minute volume is determined by taking tidal volume times respiratory rate. And anatomic dead space is something that we need to consider as well, and that's the amount of air that's not in the alveoli. That's the air that's located in the trachea and mouth and nose that stays there when you take a breath in and doesn't actually get down to the alveoli. The air that gets down to the alveoli is known as alveolar air, and that's an important concept for us to understand as well. Physiologic dead space, that's that 150 mil of air that is not participating in gas exchange. Now, gas exchange occurs when we take air in, when our venous blood travels in the capillary network through the pulmonary tissue, and factors that enhance gas exchange include temperature and pH. When we look at the oxygen dissociation curve, we can see that both temperature and pH have an effect on the oxygen's ability to leave the bloodstream and get into the cell. The Fick principle says, in order for us to maintain adequate oxygenation, we have to have several things. We have to have an adequate number of red cells. We have to have a pump that's capable of moving those cells to all parts of the body. We have to have adequate volume to fill the container. We have to be able to get the oxygen into the bloodstream. Things like pulmonary embolus and collapsed lung and those sort of things won't allow us to get air into the bloodstream. And we have to have all those things in order to get good gas exchange. Now, there are three methods that carbon dioxide is transported in your body with. The first is what's dissolved in blood, and only about 7% of the carbon dioxide that you're around is dissolved in blood. 23% of the carbon dioxide is attached to hemoglobin. 73% are part of the bicarbonate ion system. All right, the digestive system. When we look at the digestive system, digestion includes the processes of ingesting the food, mechanically processing it, that's chewing it and swallowing it, digesting it, and then both secretion, absorption, and then excretion are all processes of digestion. We have different organs of digestion, starting first certainly with our mouth, teeth and gums, and then our stomach, and then the small intestines, and then the large intestines. But we also have to include the liver, which is part of the digestive system, the spleen, which is part of the digestive system as well. The gastrointestinal tract includes the mouth, which has the salivary glands to keep your mouth moist and warm, and the teeth to break up and chew food, getting it emulsified to a much smaller amount and easier to digest. And then your tongue, which is not only used to articulate speech, but senses the different saltiness, sweetness, hot, cold, that sort of stuff of the food that you eat. When we think of the gastrointestinal tract or the gastrointestinal system, next after the mouth comes the esophagus, and food propels itself down the esophagus through a process known as peristalsis. Now, there have been some situations where peristalsis slows down, and that can be very painful. The esophagus itself is normally collapsed. The esophagus itself, when it doesn't have any food in it, often reminds me of sausage casing that isn't stuffed. It remains closed unless something dilates or opens that esophagus, and then once something's in there, through that process of peristalsis, that wave-like muscular contraction, it will propel food down into the stomach. The stomach produces acids, and the stomach helps break your food down to a thing called chyme or chyme, depending on where you live, and from there nutrients and things are extracted in the small intestine. So there's a good shot of your stomach. Trying to get it to the next slide. There we go. Now the small intestine is necessary for the absorption of nutrients. It includes the duodenum, the jejunum, and the ileum, and different things are absorbed in those different areas of the small intestine. The large intestine, that's where your water and electrolytes are absorbed. So water is removed from what's in there to help form stool. Electrolytes are absorbed into the body as well. Your sodium, potassium, calcium, magnesium, and the other parts of the large intestine we need to be familiar with is the cecum, the appendix, which is a small outcropping on the large intestine, located in the lower right quadrant, and if it becomes inflamed and gangrenous, which it can at times, and ruptures, then you have appendicitis. The transverse colon cuts across the abdomen laterally, and then the descending colon drops down on the other side of the stomach, and the sigmoid colon then is the distal end of the colon. The liver. The liver is the largest internal organ. It sits in the right upper quadrant, just under the diaphragm. It is the major detoxifier in the body. It requires bile salts to function, and releases bile salts from the gallbladder, unless, of course, you have gallbladder disease. It also is responsible for blood proteins. The gallbladder is located beneath the liver, and that's where bile is stored, and it connects to the gastrointestinal tract through the common bile duct, and the bile helps emulsify fat. The pancreas is an exocrine gland and an endocrine gland. It releases pancreatic juice, which is partly used for the breakdown of amino acids, and it also produces insulin, which is required in order to lower blood sugar. The urinary system includes the kidneys, ureters, and bladder. And the urinary system helps regulate blood volume, helps regulate blood pressure, helps regulate your sodium, potassium, and calcium, helps regulate your pH. And this, the kidneys also are important in helping you conserve valuable nutrients and the elimination of certain wastes. The kidneys sit in the retroperitoneal space behind the abdomen, behind the intestines. The kidney is made up of the medulla, the renal pyramids, the nephron, and the renal corpuscle, and they're all responsible for the filtering of blood to make urine. Other parts of the kidneys include the Bowman's capsule, and the Bowman's capsule is identified there, where you've got those loops of tissue or vessels where the filtering occurs. The loop of Henle is one of the loops that is commonly talked about when you talk about the kidneys, and certain diuretics, pills that make you go pee, work specifically in the loop of Henle, like Lasix. Lasix works primarily in the loop of Henle in helping you excrete urine. There are times when your body doesn't want to make any urine. It wants to retain fluid, particularly if you're getting dehydrated, and in those situations the antidiuretic hormone is released, which may help the body conserve liquid rather than get rid of it. The male reproduction system includes the testes, the epididymis, the ductus deferential, seminal vesicles, the seminal vesicles, and the spermatic cord. And we know the testes are important for the production of semen, as well as other hormones, testosterone, those sort of things. It's the seminal vesicles and the spermatic cord that semen is produced and created and stored in the seminal vesicles, and when the penis is stimulated, it causes a ejaculation. Also in the male reproductive system is the urethra, which extends from the bladder to the end of the penis. The prostate gland, which sits at the base of the bladder, and when it becomes enlarged, particularly as men age, and it becomes enlarged, it has a tendency to obstruct flow, and so people with prostatitis and inflammation of the prostate gland often have frequent small urinations. They're up a lot, having to go pee at night, and they don't pee much. So they take medications like Flomax, which helps shrink the prostate gland and open those ureters so that they get better flow. I'd already mentioned the production of sperm and how it is stored in the seminal vesicle until needed. The scrotum covers the testes, and then of course the penis. With the female reproductive system, we have ovaries. Ovaries, not only produce the egg that's necessary for fertilization in order for a baby to develop, but also are important in the secretion of progesterone and estrogen. Fallopian tubes, once the egg is produced in the ovary, it makes its way down the fallopian tube where it comes in contact with semen during intercourse, and the egg itself then is fertilized and attaches itself on the uterine wall. Sometimes the egg will attach itself in the fallopian tube itself and will begin to develop, and that's called an ectopic pregnancy, which often leads to the rupture of the fallopian tube, significant hemorrhage, even perhaps enough hemorrhage to cause shock and death if not noticed. The uterus is the womb. It's where the developing fetus is kept, and the vagina is the birth canal, the muscular canal that accepts the penis, as well as is the birth canal for the fetus when the baby is born. The clitoris is an extension similar to the penis in a man. The clitoris is, when stimulated, is what gives a woman an orgasm as well. The mammary glands are responsible for producing milk in a woman who's about to give birth, or usually by the third trimester, the woman is producing milk. The special senses we're going to look at here include olfaction. Olfaction is the olfactory receptors, which is your ability to smell. It's controlled by the first cranial nerve, and the nerve fibers lie in the nasal cavity. Molecules in the air stimulate these nerves, and the center in the brain interprets these impulses as odors, which I just think is amazing that, depending on the air molecule movement by those olfactory receptors, that different odors must have different molecular air movement in order for you to be able to differentiate different types of odors. So it travels through the olfactory nerves to the brain, where it is interpreted as a particular odor. Gustation is refers to the tongue, and in part, parts of the tongue is ruled by parts of the 7th and 8th cranial nerves, and these nerve fibers are located in the taste buds, and certain taste buds determine certain tastes. So you have taste buds that tell you whether food is salty, and you have different taste buds that tell you whether something is sour, different taste buds that tell you whether something is sweet or something is bitter. Sight occurs through the eye, made up of 3 chambers: the fibrous tunic, the vascular tunic, and the nervous tunic. And the iris is the part of the eye. Let me look here. Yeah, the iris is part of the eye where the lens is located, and the lens deflects light and deflects the image, much like a camera lens, through the optic nerve, where that information is transmitted to the brain, and what you see then is interpreted. Sight also includes the accessory structures around the eyes. You've got the eyebrows and the eyelids, which close and help protect the eye, the conjunctiva, the mucous membranes that slide over the eye and help keep it moist, and then you've got your lacrimal sacs, where tear ducts are held, your lacrimal glands where tears come out. And next is hearing. The ear, for all practical purposes, is divided into 3 parts: the external ear, the middle ear and the inner ear. Hearing and balance is controlled in the inner ear. And it doesn't take much in the inner ear if that structure is infected, if that structure swells. It leads to not only the inability to hear, but also room spins, lightheaded, dizzy, that sort of stuff. And it can be significant enough to where, a person is just vomiting uncontrollably and can't stand because they're so dizzy, and has been the reason for an ambulance call or two. When we look at the distribution of fluids in the body, 60% of your total body weight is water. And water is necessary for all chemical reactions, and it's kept in several compartments in the body. Intracellular fluid is 40% of the water is within the cells. Extracellular fluid is in actually two compartments. One is the intravascular space, and that's all the blood and the fluid that's inside your blood vessels. And then the interstitial space, or that third space. It's not in the cell, it's not in the vessels, it's in that third space. And that's where 15% of your water is stored. Now this water continually moves in and out of those three compartments as necessary. If there's a need to expand vascular volume, water will be pulled from the interstitial space into the intravascular space through a process known as osmosis. And the same is true if water is needed within the cells. It'll pull it from the interstitial space into the vascular space. Normal hydration requires that what we take in liquid, that we also take out. If we take in more than we put out, at some point we will be overhydrated. But if we lose more volume than we take in, that's where we become dehydrated. And one of the mechanisms that prevents us from becoming dehydrated is the sense of thirst. When we thirst, or we sense the need to have a drink, that's because our body senses the need to increase our water, the amount of water we have in it. Also, if your body's attempting to conserve water, it will release the antidiuretic hormone, which is actually vasopressin, and the antidiuretic hormone will shunt blood away from the kidneys, not allowing it to be filtered. Aldosterone is a hormone that is responsible for conserving or eliminating sodium. And if we retain sodium, we're going to retain water. If we eliminate sodium, we're going to eliminate water. Output, we lose volume through a variety of ways. We certainly urinate and we defecate, but we also sweat. Sweating is the body's natural way to dissipate heat. It's the most effective way to dissipate heat. And we lose liquid through our lungs. Every time we exhale, we're not only getting rid of CO2, but we're getting rid of H2O, or water. Now, electrolytes are substances dissolved into charged particles when they are dissolved into water. And they include cations and anions. Cations are positively charged particles, and anions are negatively charged particles. And the primary cations in the body include sodium, potassium, calcium, and magnesium. The primary anions in the body is chloride, bicarbonate, and phosphate. And because some have positive charges and some have negative charges, they often are paired together. Sodium chloride, as an example, is salt. Sodium bicarbonate is baking soda. Calcium chloride is certainly another important combination necessary for muscle contraction. I think at this point I'm going to end the Part 2 lecture. We've been at it just a little over an hour, and before we get into the complicated discussion concerning acid-base balance, I'd like to save that for the beginning of Part 3. So with that, I'll talk to you soon. Bye.